Hello, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or email us at asoundconstitution@gmail.com.
We would like to start our show by acknowledging that we are on the unceded territory of the Sunemu people, with a broadcasting range that overlaps the Kawatsan and Sliamon territories. This acknowledgement is done with gratitude to the Sunemu people and with the intention to increase awareness about truth and reconciliation processes and efforts here on Vancouver Island. Additional information and resources surrounding Sunemu history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
Hi, my name's Luke, and this week I'm joined by my co-hosts Cedric, Shan, and Stella. Together in this episode, we'll be exploring the relationship between healthcare workers, substance use, addiction, and recovery. Are you or someone you know a healthcare worker struggling to deal with workplace stress? Have you ever wondered why some substances are more socially acceptable than others? Are you unsure about how to get help or support those who are dealing with addiction? This episode will be an exploration into those questions. To start us off, we'll be hearing from Cedric as he focuses on the big picture. He shares which substances are most popular in Canada, the negative impact addiction to these substances has on Canadian society, and also the cost the use of these substances incurs on the Canadian healthcare system. Cedric, take it away.
According to the CDC, substance use refers to the use of selected substances, including alcohol, tobacco products, drugs, inhalants, and other substances that can be consumed, inhaled, injected, or otherwise absorbed into the body with possible dependence and other detrimental effects. Health Canada also states that substance use differs for everyone and can be viewed on a spectrum. Health Canada defines 5 stages for this spectrum. The first stage is non-use, the second stage is beneficial use, which is use that can have positive health, social, or spiritual effects. The third stage is lower risk use, which is use that has minimal impact to a person, their family, friends, and others. And the fourth stage is higher risk use, which is use that has a harmful and negative impact to a person, their family, friends, and others. The fifth stage of substance use is addiction, also known as substance use disorder. Someone has a substance use disorder when they cannot stop taking the substance they are using, even if they want to. Health Canada defines substance use disorder as a treatable medical condition that affects the brain and involves compulsive and continuous use, despite negative impacts to a person, their family, friends, and others. Now we will look at some statistics regarding the use of various substances in Canada. The latest Canadian Alcohol Drug Survey from 2019 that we will be looking at is based on telephone interviews with 10,293 respondents across all 10 provinces, representing a weighted total of 31 million Canadian residents, aged 15 years and older, 15.3 million males and 15.7 million females. The prevalence of past year alcohol use was 76%, or 23.7 million Canadians. From the 2019 results, males were more likely to report past year alcohol use at 78% than females at 75%. In regards to cannabis use, the prevalence of past year cannabis use was 21%, or 6.4 million, which was an increase compared to 2017 at 15% and compared to 2015 at 12%. In 2019, past year cannabis use was more prevalent among males at 23% than females at 19%. The Canadian Alcohol and Drug Survey also included questions regarding the use of 3 classes of psychoactive pharmaceutical drugs: opioid pain relievers, stimulants, and sedatives/tranquilizers. The prevalence of psychoactive pharmaceutical use among Canadians aged 15 years and older was 23% in 2019, or 7 million. The prevalence of past year psychoactive pharmaceutical use in 2019 was higher among females at 27% than males at 19%. Respondents of the Canadian Alcohol and Drug Survey were also asked about past year usage of illegal drugs. Illegal drugs include cocaine or crack, ecstasy, speed or methamphetamines, hallucinogens, inhalants, heroin, and salvia. In 2019, past year usage of 1 of 6 illegal drugs was 3%, or 1.1 million. Overall, prevalence of past year use of these illegal drugs was similar among males at 4% and females at 3%. From the statistics presented in this survey, we can see that alcohol, psychoactive pharmaceutical drugs, and cannabis were the most commonly used substances in 2019. If you would like to have a look at this survey for yourself, all of the links to our resources can be found in our show notes for this episode. Now that we have an idea of how prevalent substance use is in Canada, I would like to discuss the effects that substance use has on individual and societal health. According to the Centre for Addiction and Mental Health, substance use disorders as well as mental illness are the leading causes of disability in Canada. The National Institute of Health also states that substance use and substance use disorders can contribute to the development of mental disorders, as substance use can trigger changes in brain structure and function that can make a person more likely to develop a mental disorder. Substance use can trigger mood, anxiety, or depression disorders and increase the risk for serious mental health illness such as psychosis or schizophrenia. Substance use can also affect people's ability to work, keep healthy relationships, attend school, can have negative physical impacts, and potentially lead to financial struggles. An estimated 67,000 deaths per year are attributable to substance use in Canada, which includes 47,000 deaths attributable to tobacco and 15,000 deaths attributable to alcohol. Since the declaration of the opioid crisis in 2016, there have been over 44,000 opioid-related deaths, over 42,000 opioid-related hospitalizations, and over 174,000 opioid-related emergency department visits. As you can tell from these statistics, substance use has a significant impact on healthcare costs. For example, the annual estimated cost of substance use in Canada is estimated at nearly $40 billion, including costs to healthcare, criminal justice, and lost productivity. Alcohol and tobacco make up more than 2/3 of these costs, $14.6 billion and $12 billion respectively. Opioids make up $3.5 billion and cannabis $2.8 billion. Additionally, the drug trafficking of illegal drugs can lead to violence in communities, and the profits from drug trafficking can fund other crimes, such as human trafficking. The negative consequences of substance use on both individuals and society make this an important issue to address in our healthcare system. Thank you for listening. All of our references for this episode as well as this segment can be found in our show notes.
Thank you, Cedric. That's an important point, that substance use is best viewed on a spectrum, and I like how Health Canada breaks this into 5 stages, with substance use disorder being the 5th and final stage. For the rest of this episode, please remember that by addiction, we mean the phenomenon of being unable to stop substance use even if you want to. With that in mind, let's check in with Shan as she focuses in on substance use among nurses specifically. Shan, the floor is yours.
Substance use within healthcare settings is an important issue, especially given the unique stressors faced by healthcare workers, particularly nurses. According to the Canadian Nurses Association, in 2021, over 459,000 regulated nurses were eligible to practice in Canada, including registered nurses, nurse practitioners, licensed practical nurses, and registered psychiatric nurses. Of these, approximately 91% were female, indicating that nursing remains a female-dominated profession in Canada. This gender composition is relevant to the discussion of substance use in healthcare settings because research has shown that substance use patterns can vary by gender. According to the National Institute on Drug Abuse, while men are more likely than women to use illicit drugs, women may progress more quickly from drug use to addiction. While specific data on substance use among healthcare workers in British Columbia is limited, the issue is a growing concern. The British Columbia College of Nurses and Midwives, or BCCNM, has strict policies regarding substance use, outlining that healthcare professionals must maintain fitness to practice at all times. While substance use issues among nurses are acknowledged, the specific number of active cases managed by the BCCNM is not publicly available. BCCNM promotes a duty to report policy where nurses and other healthcare professionals are expected to report any substance use issues that could impair their ability to provide safe and competent care. Additionally, colleagues and employers are obligated to report any healthcare workers who appear to be impaired while on duty. There's a recognized stigma around substance use in healthcare, but attitudes are slowly shifting towards more supportive policies. For example, the BC Nurses Union has advocated for treating nurses with substance use disorders through supportive interventions rather than punitive measures. BCCNM supports this approach, focusing on providing support for healthcare workers dealing with substance use disorders, but substance use during professional duties is not tolerated. So why might healthcare workers turn to substances? According to an article from the Hazelden Betty Ford Foundation, several factors contribute to substance use among healthcare workers, including work-related trauma, extreme work responsibilities, sleep deprivation, chronic stress, and burnout. Occupational stress significantly impacts various professions, particularly healthcare workers and public safety personnel, including firefighters, paramedics, and police officers, leading to higher rates of substance use in these fields. Healthcare workers, especially nurses and physicians, experience stress levels comparable to those of police officers and paramedics. However, the nature of stress can vary between these professions. A study published in the Journal of Occupational Health Psychology found that public safety personnel face significant stress and PTSD due to the nature of their work, which often includes exposure to violence and life-threatening situations, while healthcare workers often face moral distress from ethical challenges in patient care. This chronic stress can drive individuals to seek relief through substance use as a coping mechanism. Since the pandemic, burnout among healthcare workers has skyrocketed. An article from the National Library of Medicine found that burnout rates jumped from 30% in 2018 to as high as 86% in 2021 for physicians and 75% for nurses. Aside from the high stress and burnout, accessibility to medications could also contribute to substance use disorders and drug diversion. Healthcare workers may have easier access to controlled substances, especially in hospital settings where narcotics and other medications are readily available. However, nurses, physicians, and other healthcare professionals in Canada must adhere to strict protocols for handling narcotics and controlled substances, which are subject to legal and institutional scrutiny under the Controlled Drugs and Substances Act. According to the Canadian Society of Hospital Pharmacists, misuse or diversion of these substances can result in severe legal, professional, and ethical consequences, including loss of licensure. Healthcare settings have implemented safeguards, such as narcotic counts and auditing processes to minimize opportunities for substance misuse. These measures help to prevent easy access, though diversion cases still occur and are met with serious penalties. Understanding the issue of substance use within healthcare is crucial. While policies and safeguards exist to protect patient care, we must also prioritize the well-being of healthcare workers. Reducing stigma around substance use and promoting a culture of support are key to ensuring that those who need help can seek it without fear. Awareness is the first step toward creating a healthier, more sustainable working environment for those who dedicate their lives to caring for others.
Thank you, Shan. It's encouraging to know that healthcare institutions are seeking to establish supportive interventions rather than punitive measures. If you're just joining us, this episode of A Sound Constitution is all about exploring the relationships between substance use, addiction, and recovery, all within the healthcare setting. In our next segment, we will be hearing from Stella as she explains the ramifications nurses face if they're caught using substances at work and just what recovery in the workplace looks like. Stella, what have you found out?
Hey everyone. So many people wonder what happens to healthcare professionals when they get caught or they confess to using substances and having a substance use disorder. And can they even return to work? Well, the short answer is yes. There is the possibility that they can return to work. However, there is a process to this. Currently, the process that BCCNM, also known as British Columbia's College of Nurses and Midwives, offers a non-individualized approach to return to work, meaning that if you're given the opportunity, everyone goes through the same steps to return. But first, I'll explain the process to determine what your consequences even are. When the reports first come to BCCNM, they have to do an investigation to determine the legitimacy of the report and the severity. This will include having the registrant to undergo an independent medical exam. Then, once the investigation is over, they will move on to the inquiry committee, who will look over the investigation and make a decision on how to move forward, whether that is giving a citation, which means moving forward to the disciplinary hearing, or not taking any further action. Lastly, the committee will issue the citation, which means they will be moving on to that disciplinary hearing. At this point, depending on the situation, they will be given their consequences. This could be a suspension or even having your license revoked. However, if they are given the opportunity to come back to work, they will be asked to go through a series of steps. First, as I said before, as soon as the BCCNM hears of the registrant's possible substance misuse, they will undergo an independent medical exam. Then, they are given a return to work plan that includes inpatient treatment at a privatized facility, followed by a 12-step program. They also must remain completely abstinent from all drugs and alcohol, as well as engage in ongoing testing to prove their sobriety. If they fail to follow this plan, they are at risk to lose their job and their license to practice. However, if they follow all of this and remain sober, they can return to work. This process is basically the same for each healthcare worker, regardless of the worker's past treatments or experience. However, BCNU, also known as British Columbia's Nurses Union, and some other BC organizations released a report in 2019 with the hopes to work with BCCNM to develop an individualized plans to help deal with substance use disorder in healthcare workers. In the report, they listed 3 goals that could help improve this process for nurses. These 3 goals are 1. Promote evidence-based, patient-centered treatment approaches. 2. Reduce opportunities for harm and coercion, including addressing conflicts of interest that may exist. And 3. Promote individualized risk management. By doing this, they recognize that there is not a one-size-fits-all fix to substance use disorder, and it even reduces the risk of relapse. They have many recommendations for each goal in order to improve this process. The first goal, promoting evidence-based patient-centered treatment, has some of the following recommendations. To promote individualized treatment plans, including pharmacotherapies, based on the substances being used, severity, previous treatments, and co-occurring conditions. Another was base the return to work decision on a systematic assessment of risk and treatment options. Also, to enhance overall research on nurses with substance use disorder and make that information public, as well develop funds to procure extended release naltrexone to be offered as a treatment. The proposed action includes developing standardized, comprehensive forms and support for those evaluating substance use disorder, funding that extended release naltrexone, fund and establish a peer-navigated programs, and support for nurses with substance use disorder. For the second goal, to reduce opportunity for harm and coercion, encourage nurses with substance use disorder to keep control over choosing healthcare providers, and give them input on their treatment plans. Ensure it is publicly funded so that the nurses don't pay out of pocket for their treatment. Ensure nurses know that consent can be given and taken away at any time during this treatment plan. And lastly, maintaining a safe environment by keeping employees' privacy. The third goal of promoting individualized risk management includes taking away risks whenever possible, determining the requirements for medical monitoring based on a case-to-case basis. Whenever not appropriate or no longer needed, remove the medical monitoring. And lastly, develop an evidence-based safety checklist. Due to the amount of stress nurses are under, it is no wonder substance use disorder is not an unusual occurrence, so these policies can help support these people and reduce the chances of relapsing. The road to recovery is a long one, but it's not impossible, so hopefully we can see this shift in the near future to better support our healthcare workers with substance use disorder.
Thank you, Stella. We applaud BCNU's efforts to improve the recovery process for nurses in BC. It's so important that we, as the healthcare field, continue to develop policies that support healthcare workers and reduce the chances of relapse. As Stella said, the road to recovery is a long one, but it's not impossible. This leads us to our next segment, in which we will be listening to an episode of the popular healthcare podcast, The Burnout Antidote. The Burnout Antidote is a co-production from Psych Hub and is co-produced by Janssen Neuroscience. Here, social worker and host Amy Perlman is joined by her co-host and counselor Paul Daguerre. Amy and Paul have an in-depth discussion on addiction, recovery, stigma, and the notion of coping mechanisms. They also hear from a physician as he shares his experiences of both being in recovery himself as well as helping other patients in recovery. We hope you enjoy.
From the Psych Hub Podcast Network.
Hi, everyone. Welcome back to the Burnout Antidote, infusing well-being into healthcare culture. I'm Amy Perlman. I'm here today with my colleague.
Hey, Paul Daguerre. Good to be back with you, Amy.
Thanks, Paul. And today we are going to talk about substance use disorders and other addictions in healthcare clinicians.
Yeah, what an important topic to include for so many different reasons. And recognizing that, one, we're going to make this a broad discussion around the topic of the experience of addiction. So substances, but there's also process or behavioral addictions that people have. Also this idea of stigma and how that is such a barrier to people getting the necessary care for recovery. And because we're talking about something work-related, how often substances and other process addictions are used as a coping tool. We're going to go broad on this topic, but I think we're going to give it the broadness it needs for a good, thorough discussion. And I want to speak to, this was going on before COVID. I remember learning about organizations who, rather than immediately taking somebody's license away, that offered them an opportunity for healing and recovery. And that the stress within healthcare already, there was a high prevalence of substance use. And I haven't looked at latest stats. I've ill-prepared, Amy. I didn't go in the research this time. I'm sorry. But I think we know that substance use disorders increased during COVID. So I can only imagine that was healthcare clinicians as well as the general public.
And I think that there is this other component here, and maybe it's tied to stigma to some extent, Paul, but
yeah.
Even as we were introducing the topic or this episode, I think substance use as a coping strategy really has come with this idea of kind of coping with humor to some extent. That in addition to the access to substances, or even if you think about the idea of like overworking as an addiction, there really are tons of components here that encourage people or give them more access to use substances. I think the idea of substance use as an escape, but also substance use as a way to socialize, or something that has become kind of lighthearted in discussion, whereas it's not really a lighthearted topic for people who are suffering from addictions.
Yeah. And how that creates a further sense of otherness, I imagine, when some people are speaking of this in light terms, and it may be destroying your life.
Huge culture components here for the broader society, but in the healthcare realm as well.
Yeah, agreed.
So for our story this week, Paul and I approached a colleague that we both know who is in recovery. This is someone who has taught me quite a bit about recovery and about the impact of substance use disorders in the workplace, but also really just in life in general. So I'd love to have him share a bit of his story with the group.
Amy, I think a little context also regarding this story for someone who maybe they haven't started their recovery or they're early in it, that this is hearing from someone with long-term recovery, which I think brings amazing value, but also not putting pressure on yourself if you're just starting out.
Thanks for highlighting that. I think about this idea of being an expert based on your own experience, kind of that lived experience of knowing that we are each our experts in our own lives, that this is just one story. And it happens to be a story of someone who's had quite a bit of experience in recovery, but it doesn't speak to every story.
All right, let's listen and see what there is to learn.
My first job was at a county Department of Health and Environment. It was a drug and alcohol program, and I'm really tasked with working specifically with the adolescents that would come in for services, their families, and then their subsequent criminal justice or social work interactions as well. At this particular organization, we were not encouraged to share anything about our own recovery experiences if we were in recovery. And there was at least one other person on my team who was in recovery. And both of us felt a little conflicted about that. There was a piece of me that thought that perhaps it would be helpful to join a bit and let them know that I am a person with lived experience. But the other thing I struggled with was also my age. I was still very young, in my mid-20s. And in some circumstances, I thought, who am I really to share my experience when these are parents who are in their 40s, 50s, who are dealing with adolescents? I have none of that. It was early in my career. I was very conflicted. I wasn't encouraged to share that. And when I got to my second organization, it was actually quite refreshing for the staff to say, Eric, it's okay. You can share that, those experiences. And they would caveat that a bit with saying, but be strategic with how you do that. And what they meant by that was being conscientious of my own experiences and how they may impede someone's ability to find their own pathway to recovery. That was something that I really tried to strike a balance of. And I will admit that for the first couple of years in my second job placement, I still continued to not really share that about myself professionally. And it wasn't until probably the last couple of years that I was at that particular organization that I felt a bit more comfortable bringing it out when I thought it was appropriate or it seemed to make sense in that circumstance. When people were really struggling with, for instance, how do I go to my first 12-step meeting? Or I don't understand what my kid is thinking, and those kinds of things. And so I did find that there were times where I felt a bit more comfortable bringing it up. So I moved away from direct care into something that was more administrative in nature. And by that point, I had gotten to a point where I had been doing so much counseling that I really had a desire to make a bigger splash in some kind of capacity. I wasn't quite sure what that meant yet. But once I got into that more administrative function, I really settled into a routine of supporting an organization that was launching a behavioral health product for a number of different employers that had a particular health plan that was integrated with medical and behavioral health. It really was something that resonated philosophically with me from that perspective. It actually, for probably 6-7 years, the first half of my career at that particular organization, didn't really have opportunities to bring up the fact that I was in long-term recovery. And I continued to develop those years and learn in my recovery along the way. It wasn't actually until the last 7 years at my former employer that I became reacquainted with how do I share this aspect of myself. And at that point, I had taken over some SUD and opioid overdose response strategy responsibilities for the organization. So what that meant was that I really had to work across the entire organization in a number of different capacities to think about how we as an organization were going to address this issue, and then how we were going to do that in a way that was conscientious of state and federal policy. And so there were definitely times where, in order to have a sense of legitimacy of why would they choose this Eric Bailey guy to do this, I did take an opportunity to start to shape some of my own messaging and my own identity to be strategic with how I actually shared that about myself. I will say that the legitimacy that's given to people with lived experience has taken on a new level, where recovery care organizations exist in this country and so forth. And I think in some ways that's really helped to have that legitimacy to help improve the competency and the comprehensiveness of the workforce in this space. A couple of takeaways from this as a person in long-term recovery would be to be strategic with how I share that with individuals in the context of what I do on a day-to-day basis. Being able to recognize who my audience is and when it may be helpful to bring in my own experience and when it's better to just simply listen and to pull in information and not insert my own experience, which sometimes can actually be counterproductive, which I've definitely seen that occur in the past as well. I think for me, that's really helped keep me grounded and to recognize that those experiences do have a role to play, but it's not necessarily everything. Recovery definitely weaves its way into every aspect of my life, and it has for almost 33 years now. But recovery isn't the only thing that defines me.
I love that you highlighted our colleagues' stage in recovery, because it was very clear from that impression that there was some space from the amount of time with substance use, that
space and perspective that comes
the
with
perspective
it.
that comes with it. And I think when you think about one day at a time, those days do add up. And I don't want to minimize that recovery is hard work, but I also do want to acknowledge that I think it does get easier over time.
Yeah, there was so much richness that heard an evolving understanding of self and where substances fit in. And even though the focus was more, this was someone talking about self-disclosure with clients, I think there's also considering self-disclosure with coworkers as far as where I'm at in my process of recovery. And also I heard a strong sense of where is it safe to share and where is it not safe to share. And again, I always want to take this back to systems and the collective. Are we creating an environment where it's okay to be human and have flaws? Or are we reinforcing the myths around superheroes? You know, healthcare clinicians are perfect and superheroes and have no flaws. And I think that was something I heard in his evolution in different workplaces. There became more recognition of it's safe to be human here.
And I like that juxtaposed with timeline and how our culture as a larger system has evolved as well. And I'm pleased with where that evolution has gone in terms of bringing in an increased humanity. And I almost thought about it as two cultures, one of a workplace culture and one of a recovery culture.
Oh, interesting.
And where do those align and where do they kind of bump heads maybe? I started thinking about a recovery culture around this 12-step process of owning who you are, owning your addictions, and building a community. And that with this idea of pulling back on self-disclosure, having a workplace culture where you're expected to be a superhero in your world, like in your words is what I meant, Paul.
Yeah.
This idea of having to live in kind of two worlds, almost thinking about this as a story about recovery more than a story about an addiction, even though that spectrum of addictions really has included recovery.
For those of you who have just tuned in, this segment is an episode of podcast The Burnout Antidote. Here, social worker Amy Perlman is discussing the prevalence of addiction in healthcare workers with her co-host and counselor, Paul Daguerre.
Well, what I hear in that is, okay, if your workplace is not a safe place to share, then finding that someplace else in your life to make sure that you have a place where you can begin to reinforce what are the components needed for recovery. The other thing with that timeline part that stood out to me was I love when he talked about when he came to a workplace where disclosure was a little more accepted and recognized as powerful, not just for self, but for other healing or others healing, how he said, I got reacquainted with how to share. And it takes me back to actually last week's episode on storytelling, and that every time you do reveal a story about yourself. I remember, okay, I'm going to kind of go on a tangent, but it'll tie back in, trust me. If we look at how memories are formed, every time you recall a memory, you're actually reconstructing it. And that's the beauty of narrative therapy, where you can now become the author of your own story. And that's what I heard with this reacquainted with sharing his recovery story of each time you revisit it, you get to retell it in a way that moves you forward in the process. And to me, that is really important to remember, that it's not written in stone, that as we retell the story, we can add layers of insight that maybe weren't there earlier for no fault of your own. It just wasn't time yet. Back to that readiness idea. So I love how last week's episode and this one tie together with the power of story.
I want to tie it in, and I'll throw a statistic in there too for you, Paul, because I know you missed those.
We haven't had one yet. So yeah, we need one.
So I started thinking quite a bit about self-disclosure and what is that impact on self when you start to think about, are there parts of you that you can't have present, or what you can choose to be visible and what you don't choose to be visible? And I also started thinking about what was the impact of that for people that we work with. I have a hard time with the patients or clients or the us and them, so I don't always know what words to use.
Okay.
But when I looked, and this was a study around therapists specifically, but over 90% of therapists report self-disclosure in their work. And that also showed an overwhelmingly positive result in two ways. One, that the client, patient, people we serve, the other, perceived that humanity as more of a connection, even if the disclosure was not something that they had in common.
Okay.
And the other component, and I don't remember the numbers on these two, but the other component is that the therapist felt that they did a better job regardless of what the outcome was. And I really want to focus on this feeling of doing a better job, because that's what I felt tied it to burnout in my mind.
Okay.
Is this
that idea of having an impact?
Having an impact, being genuine, all of that, building a connection that seems to improve the relationship on both sides. So I just wanted to throw that in there, because that to me felt very different than even how I was trained in terms of blank slate,
right? Kind
of sitting behind the couch type of therapy, which doesn't feel as genuine to me.
And another quote that I have from our story today is the legitimacy of lived experience. And that's what I'm hearing you give the sense of as a clinician when we show up with our flaws. And that may not be the best word, but when we show up with our chinks in the armor,
our humanity,
our humanity, there we go. Our imperfectness. We'll go all the way back. Got to bring up Tekla. We haven't done that in a while. But we bring back being imperfectly human. That has a power with not only ourselves and our colleagues, but with the patients as well. And I want to, coming back to substance use disorders, the stress that healthcare clinicians have been under pre-COVID, and then COVID just multiplied that so many times. I get people grasping for something to feel better, even when it had short-term gains. And I really want to honor the fact that you guys are working hard out there and you deserve to feel better. And some of you may have reached out for substances or other process addictions to do that. And you're going to be okay. And there's people who care about you. I feel like I'm a bit of a rant, but I can't help myself here. And this idea of your story has value when you're ready to share it. It has value and power around this topic.
I love that, Paul. I think that's the part where I'll put my hand on my heart for you. If you were in person, maybe my hand on your back. But really offering that level of support to think about recovery is not linear. I think we've seen this in our own lives, whether it is a formal addiction or it is a pattern in our lives, I think that's something we can all relate to. And thinking about the culture of when you question, is this in the realm of a disorder, or is this something that is a reaction to a certain event, or is this something that is this something I'm concerned about or the people around me are concerned about? And being able to have that conversation with people in your lives. And what would it be like to have that conversation in the workplace as well?
Yeah. I think there is a slippery slope here. And when I'm hearing you talk about this idea of functioning and when do I start to notice I'm not functioning as well, not just due to the stress itself, but due to my coping tool, in this case, the substance. And that's when it's time to take some steps. And I want to honor the fact that in delivering patient care, we want to make sure that the patient is safe and do no harm. I'm not discounting that, but I'm taking, have yourself part of the equation of what needs to happen next for the well-being of myself and my patients.
And that makes me think of one of our skills of self-compassion and really going into that component of understanding that this level of stress or moral distress is not sustainable. And that all of us have different ways of coping. Some of them are more functional than others. For those of you who can't see me, I did just give a little air quote because I'm not sure that's the right word I want to use, but some work better than others. And this idea of authenticity or self-disclosure, and it could be self-disclosure around struggling with a peer or a supervisor, or it could be self-disclosure around a common shared challenge or recovery with people that we serve, really creating this community.
Yeah. As you were speaking, what occurred to me is tying this back to moral distress and moral injury. By definition, it's traumatic. And if you are experiencing moral distress, you are experiencing a form of trauma, and that you deserve to be healed and feel better. And so with today's episode, it's recognizing that maybe the first way of feeling better is causing you further harm. And it's time to get some good help, because you can recover. Just like from our story shared today, recovery is possible.
I think that brings us into some of the self-exploration that we'll take as our takeaway skill for this week. But some of that is, how do I cope? How is that working for me? Right. Who can I talk to help me get different perspectives? That also brings in last week's storytelling to some extent of sometimes we don't always see what's working and what's not working, as well as our peers may be able to see with us. So who's a trusted person around that and the impact?
Right.
And then I also encourage people to think about this idea of self-disclosure. Does your workplace have a policy around self-disclosure? How do you react to disclosure from your peers or from your patients? Especially when that is coming around addictions. I think, what are those ideas we have in our minds around what addictions mean? And then I also wanted to think about self-disclosure in terms of what feels safe and what does not feel safe. What are self-disclosure is not always the answer. Where are your boundaries? What do you want to share and what do you want to keep to yourself in terms of doing this work? And when would you want to share it? With whom?
All good things to ponder. And I want to get a little practical as well.
Go for it.
On this topic. In researching today's topic, I came across programs, now they're for nurses by states, and I can't remember the acronym, but it's basically many of the states, I think the majority of them I noticed, actually have programs where you can self-report that experiencing a substance use disorder to And these programs work with the boards in your state, on rather than immediately just license over, career gone, making a commitment and a plan and follow through on recovery. And so imagine how terrifying it may be to think about, decades you've invested in this career and it could be ripped away. There's programs out there set up specifically for this scenario, to a way to maintain your license, get the treatment you need, and then return full and recovered to the work you love doing, helping others.
Thank you, Paul.
Once again, that conversation was from the Burnout Antidote podcast. The episode touched on how having flaws is a sign of humanity and thus can allow connection between patients and healthcare workers. Amy and Paul also brought up the topic of stigma. According to the Government of Canada's webpage on health, overdose-related deaths and other harms are affecting our friends, families, and communities. Addiction is not a choice. It is a treatable medical condition, yet many people affected by addiction face stigma. Stigma is negative attitudes, beliefs, or behaviors about or towards a group of people because of their situation in life. It includes discrimination, prejudice, judgment, and stereotypes, which can isolate people who use drugs. Stigma makes it harder to reach out for help. We can make it easier for people to get support by letting them know they are not alone, and that substance use does not define who they are. Addiction is a treatable medical condition, not a choice. People who use drugs, especially those struggling with addiction, face discrimination and barriers to getting help. Stigma can lead a person to avoid getting help because they are afraid of judgment or getting into trouble with work, their loved ones, or even the law. Stigma can cause a person to hide their drug use or use drugs alone. Stigma can affect a person's ability to find housing and jobs, which then affects their health and quality of life. And stigma can contribute to people who use drugs receiving a lower quality of care from the healthcare system when they access services. Addiction is not a choice. There is a common misconception that addiction is a choice and that people can stop using drugs when they want to. Addiction is complex. People develop addictions because of many reasons, including events in life, like trauma and chronic stress, environmental factors, mental well-being such as emotions, thoughts, feelings, and mental illness, as well as genetics and biology. Some people try drugs once or use them occasionally. Others use drugs more often, sometimes to try to cope with trauma or pain. No matter the reason, no one chooses to become addicted. Addiction and physical dependence make it hard to stop using drugs even when it's hurting you or people in your life. Recovery is possible, but it looks different for everyone. There are 3 types of stigma. Self-stigma happens when someone internalizes negative messages about people who use drugs and apply those messages to themselves. This can lead to low self-esteem and feelings of shame. This can cause someone to not access support because they fear being judged or discriminated against. This can cause someone to hide their drug use or to use drugs alone. There's also social stigma. This is negative attitudes or behaviors towards people who use drugs or towards their friends and family members. There are negative labels and images in everyday conversation and in the media. There's talking about addiction like it's a choice, and as well as the judgment and discrimination from other people can lead to self-stigma and cause harm such as not reaching out for help or using drugs alone. And there's also structural stigma. These are policies in health and social services that increase stigma, such as not providing services until drug use is better managed. Workplace policies that cause harm and unintentionally encourage people to hide their drug use or prevent them from seeking help. So how do we change how we talk about drug use? The language you use has a direct and deep impact on people around you. You can reduce stigma by changing the words you use to talk about drug use. Using kind words can make it easier for someone to speak up, to feel understood, or to receive help. You can use first-person language. For example, say, person who uses drugs instead of drug user. Use neutral, medically accurate words when describing drug use, and avoid slang such as addict or junkie. You can use language that shows care and concern rather than judgment. And you can speak up when you hear someone being treated or talked to in a disrespectful way. We can also use language that acknowledges and promotes the fact that recovery from addiction is possible, and it looks different for everyone. Finally, we can take these important steps to reduce stigma. Do not define any person by their drug use. Be respectful, compassionate, and caring to those who use drugs, and educate your friends and family by passing on facts that challenge stereotypes. Remember that addiction is a treatable medical condition, not a choice, and is deserving of care just like any other medical condition. Be aware of your attitudes and behaviors, because they may be influenced by stereotypes, negative stories, and/or images about people who use drugs. Once again, that information is taken from the Government of Canada's website, canada.ca. To view that information, simply go to canada.ca and follow the links for health, healthy living, substance use, and controlled and illegal substances. We'd like to conclude this episode by shedding light on a few valuable resources. The first is a screening questionnaire taken directly from the Center for Addiction and Mental Health. The questionnaire, called the CAGE questions, can be a good way to inquire into your own substance use and get you thinking about your relationship with addiction. Simply ask yourself the following 4 questions. Number 1, have you ever tried to cut down on your drinking or other drug use? Number 2, have you ever felt angry at or annoyed by someone else's comments about your drinking or drug use? Number 3, have you ever felt guilty about your drinking or drug use? Or number 4, have you ever used alcohol or other drugs as an eye-opener? That is, have you used first thing in the morning? Having thought about these questions can enable people to more effectively engage with healthcare professionals. It's also important to keep in mind that there is no one-size-fits-all approach to addiction treatment. Choosing the appropriate treatment depends on the severity and type of addiction, the support available from family, friends, and others, as well as the person's personal motivation to change. Regardless, a great place to start is by calling 811. 811 is a free of charge provincial health information and advice phone line available in British Columbia. The 811 phone line is operated by HealthLink BC, which is part of the Ministry of Health. By calling 811, you can speak with a health service navigator who can help you find health information and services, or connect you directly with a registered nurse. Any one of these healthcare professionals, which include dietitians and pharmacists, will be able to help you get the support you need to manage your health concerns or those of your family. A health services navigator is available to speak with you 24 hours a day, 7 days a week. In addition to this, you can contact the Alcohol and Drug Information Referral Service at 1-800-663-1441. They provide free, confidential, multilingual information and referral services for people in BC in need of support with any kind of substance use, including alcohol or other drugs. Again, that is the Alcohol and Drug Information Referral Service. They are available 24/7 at 1-800-663-1441. Finally, I'd like to thank my co-hosts this week, Cedric, Shan, and Stella. This episode would not have been possible without all their tremendous hard work.
For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY, A Sound Constitution, or our Twitter at ASC_VIU. If you've missed parts of this episode, or would like to listen to this episode or episodes from our past shows, check out our YouTube at The Sound Constitution. Otherwise, we'll see you all next week.